Hurricane Fiona moving over the Dominican Republic today after it knocked out power across all of Puerto Rico, causing damage the governor there called catastrophic. Over 25 inches of rain was forecast for Puerto Rico's southern region, and as much as 15 inches were projected for the eastern Dominican Republic. The hurricane is moving out of those areas at around 9 miles an hour, and it's a strong Category 1 storm with 90-mile-per-hour winds. It could reach Bermuda as a major hurricane as early as Wednesday. And joining us live right now from Puerto Rico this afternoon is Dr. Michelle Carlo with the organization Direct Relief.
In the last 5 years since Hurricane Maria, Direct Relief has spent significant time and investment stocking the island with medical supplies and also building solar-powered community treatment facilities if the grid fails like we're seeing now. Dr. Carlo, tell us what things are looking like on the ground there today.
Thank you so much for having me. Well, unfortunately, despite this storm being a Category 1 hurricane, we're seeing damages that are parallel to what we saw 5 years ago with Hurricane Maria in certain areas of the island, especially the southwestern part of the island where the hurricane actually made landfall.
And you're really focused on addressing the needs of health centers and just people's health in that area. How are you all doing that?
So thanks to the robust network of partners that we have been able to build over the past 5 years, Direct Relief has really put a lot of effort in identifying and investing in initiatives where we can attempt to increase access to healthcare in the face of this type of emergencies. And as you well mentioned, this includes the installation of solar panels and solar batteries in healthcare facilities, as well as in electric powered water pumps, because as of now 750,000 Puerto Ricans are without water still, so that we are attempting to close the gap to access this type of essential needs, especially in the face of an emergency.
And Dr. Carlo, it seems that 1,000 or more Puerto Ricans have been rescued who were stranded by the storm. Even though this was a weaker storm wind-wise, it's bringing tremendous amounts of rain and water, deadly mudslides possible, catastrophic disruption of the infrastructure. What have been the major barriers to the search and rescue efforts as far as you've seen?
Well, as you very well mentioned, I think access in every sense of the word, because so many rivers have overflowed, and there's been landslides that have included major highways and bridges. It is hard to get to the people that need to be rescued or helped. Just now we heard of a community of 17 families that are isolated in Maunabo, where there is a young woman needing dialysis treatment that needed to be rescued, and this is just one of the many stories. And I just heard someone on the news say that it doesn't matter if it's a Category 1 or a Category 5, if at the end of the day the end result is the same, where people are losing their lives and there's already been 4 reported deaths, it's still a huge catastrophe in Puerto Rico.
And Dr. Carlo, has there been enough of an extensive investment in power to really avoid what we saw in 2017?
That's a good question, and I think the answer yet remains to be seen. As of today, 70% of Puerto Ricans are still without power, so it's going to be largely dependent on how quickly they can get power back to the island. During Maria, there were areas of Puerto Rico that were without power for 6 months. Direct Relief is working hard to invest and push for alternative sources of energy, including renewable sources, solar power, and is expanding these efforts not only in Puerto Rico, but in the general region that is prone to hurricanes, and in the United States as well. So we hope that these efforts get wind speed, pardon the pun, and people jump on the bandwagon to get this working in Puerto Rico, the sooner the better.
What smart planning and incredible what you guys have done with the solar battery backup systems now powering your clinics to treat people. What are you guys seeing in terms of medical treatment? I mean, what are most people coming in for to the clinic? How bad a shape are some people in?
So we just got requests. We are in contact. We have been sheltering in place directives still, so we haven't been actually out and about. We're getting communication from our partners all over the island. We've been requested some medical equipment to treat minor trauma. We've been requested PPE because as of now we're still using PPE for the COVID pandemic, but we are in an assessment stage. We expect to be out and about tomorrow to be able to deliver hurricane preparedness packs that we actually have all sorts of antibiotics, insulin, medications that we can actually deliver to those physicians who are on the field delivering aid via outreach programs that our clinics we have supported in our clinics.
And then Dr. Carlo, just lastly, I know before we got on air, you talked about how this is a long day, so we appreciate your efforts there. Can you walk us through what your days will look like over the next coming week there in Puerto Rico?
So for direct relief, our team will be boots on the ground, receiving information constantly from our partners, both as to needs and immediate, short and long-term needs for them to continue doing what they're doing in bringing medical services to the most vulnerable and underserved areas of Puerto Rico, as well as what has worked and being successful of the things that we have established in the past 5 years. So it's going to be a very interesting and useful 2 weeks in gathering information to identify where to place resources so that this type of thing doesn't happen again.
Dr. Michelle Carlo with Direct Relief live from Puerto Rico. Thank you again for taking some of your valuable time to chat with us today. And